Hey, my medical coding family, let's see if you guys can hear me. Let's see. I can't tell. Yeah, I think so. I think that should be working. Except for I have like the header wrong with the wrong date or something at the top, but that's okay. We'll deal with that later. How's everybody doing today? Let's see how TikTok's going. Let me finish this. Let me get rid of this. I don't like this thing being on the screen. Can I get rid of that? And there we go. Hey Dee, how's it going? Okay, can you guys hear me on YouTube okay? Y'all are hearing me okay? Yay, okay, good, perfect. All right. I feel like crap right now. Let me tell you guys. I don't know if it just hit me that, I've been dealing with some stuff lately, but I do not feel good right now. So I brought up some practice questions that I bought from Exam Edge. And I never have gone through them all. And I thought we could go through them together because they at least have them written for you guys. And then I don't have to write them, right? So um, poor Travi, um, finding out he's got that aortic blockage, but in two main arteries is just hitting my soul right now. So he also hadn't pooped in a week. So that was like traumatic. But I just got a text message from him because, of course, the child cannot stay away from school. He even freaks out when he cannot go to school on the weekends. He likes to be at school all the time. So I took him at noon today and he texted me at 3 o'clock saying, I've pooped 3 times. So yeah, that was a great text to get, but I feel like crap today. So I don't know if you guys can see these questions because the way they come at me on my website, they are they keep resizing. Every time I go to the next question, I can't format my page the way I want to. And anyway, I am just doing what I can do so I can hang out with you guys today. But of course, it's not going to be a very good quality because I don't have them formatted on a Word document, and I can't format the size of the font the way that I want to. So I'm just seeing, I don't know. Don't forget that you guys on YouTube, if you guys are watching this on YouTube, if you tap on the screen, there will be a little window that will pop up at the top. That's a little settings wheel. If you click on that, then you'll get the playback quality that comes up. Click on that and change it to a higher picture quality. And then that way, when you rotate your screen and you're watching the video, maybe you can get to where you can see the font size of the question at the top. Also, with you guys on TikTok, down in the bottom corner down there, if you guys click on the three little dots down there and scroll all the way over, there is a settings button way at the end. And then you can upgrade your video quality on this live stream so that maybe you can see the questions a little bit easier. Hey, Go Kart, how are you guys doing? But anyway, I'm struggling. I don't know. If you guys don't like this and you can't see the questions, I can just turn this off and we can do book prep or something. But I love you guys. Okay, so y'all are saying the answer is C. Let me check your answer. And you're correct with that one. That is correct. All right. Let's go with this one. Can you guys see this one? Yeah, you should be able to see this one. Which radiology subsection is going on with the 75606? And just in case you guys wanted to get some of these questions, if you like these questions, I did add a link to my website. So right before we went live. So if you guys are on my website at medicalcodingbyjen.com, of course, and you scroll down past that lovely lady's elbow, there's a link for Pocket Prep. And you guys know we love Pocket Prep. But there's also a link now for Exam Edge. And yep, we have them both on there. Exam Edge has 10 practice exam question sets, each with 100 questions. Let me see, I keep going too far with the camera. There we go. So yeah, we've got the pink bubble for Pocket Prep, and then we've got the pink bubble for Exam Edge. So on my website, this is what it looks like when you go to my website, except for YouTube is not there. And I've got the links there for Exam Edge and Pocket Prep. If you use those links, I do get a little bit of kickback, maybe, I think with Exam Edge. I don't know. I don't have anything set up with it, but also with Pocket Prep. But Exam Edge has 1,000 practice questions. They do not come with page numbers like Pocket Prep does. Pocket Prep's great because it gives you page numbers where answers are, and some of their questions are better quality instead of one sentence questions like Exam Edge. Exam Edge's questions are simpler questions, one sentence and then here's your question, what's your answer. It just seems like a simpler format instead of examples like George is having trouble with this. But anyway, if you want 1,000 questions for about the same money, $40, that is Exam Edge. And what we're doing today. Y'all are saying B. B is correct with this one too. We can go through these really, really fast as you guys can give me an answer. So we can do a lot more questions. Plus, I can help you guys answer questions. Thank you so much. Kanisha, good to see you, hon. How are you doing today? Oh, what am I doing? I'm pinning that. Hey, Bluey. Hey, Go Kart. Hey, Sabrina. You rescheduled mine? Not ready. Aw. What's going on, Sabrina? Thanks, Go Kart. I'm working on the male genitalia system notes for 2026 because this section has a bunch of new codes in it. So I'll update these notes for this year. I'm finished with my business of medicine notes for 2026. I just need to take a picture of them and post them up for you guys. So gotta get that done. What do you guys think is the answer for this one? You can't see on your phone. You can cast it to a bigger device too but you're not home yet. I'm so sorry. This is like EO1, EO1, yeah, EO 1.0, 0.8, 0.1, or 0.2. Which one would be the diagnosis for unspecified iodine deficiency related goiter? A lot of times it can be a 0 or a 9 that's unspecified. We don't have a 9. O, 1, 2, or an 8. How do I sign up for the boot camp? So if you go to my website, medicalcoding.gen, right? You go to the menu page, drop down menu, go to video replays. I don't have a new boot camp scheduled yet that we're going to do together because they're 8 hours long, right? And I've got a lot of stuff going on with Travi. He's got to see because he's got the superior mesenteric artery blocked and the renal artery blocked. We're going to have referrals and stuff. So he's got an appointment Thursday with PCP to get urology, cardiology, vascular surgeons, all kinds of stuff going on. But I just did one in October, so it is right there. If you go to video replays, the link will never change. Once you purchase it, then you can watch that replay. I did it earlier in the year in July, so the first one is right there too. And it's the same PowerPoint presentation. I just swapped out the questions. So if you want to get a new set of questions, you can always do this one. This one's 7 hours long. The one that I did in October is 8 hours long. It might have a little bit more E&M in it because I took away some of the business of medicine and then added in a few more E&M. But essentially, I just swapped out the questions. You know, you get all 18 areas of the entire certification exam. Even if you're doing CCS or CCA, this is super helpful because it's kind of like a mini course. I show you guys how to do the each section, you know, integumentary. What do you need to look for? What's interesting about those CPT code descriptors or guidelines that you need to worry about? What my prediction codes are that I think might show up maybe on your exam. And then we'll do practice questions. How do you tackle these questions? That kind of stuff. So it is 8 hours long and they're right there for you guys. One of the things that I have coming up is this Saturday, if all goes well, um, and there's not an emergency in this household. This Saturday, I'm doing a 2 hour Zoom lesson where you guys will be sent practice questions individually to do on your device when you join Zoom with me. And then you'll answer them just like it was a real exam question. I'll give you guys 2 minutes per question and then we'll go over the answers. This way, you're not influenced by chat when you're looking at the correct answers, right? It'll just be you and your device, and you can't see what everybody else is answering. So that will be super cool if you want to join in on that class. It's this Saturday, 11:30 Arizona time zone, and it is only $6 to find that. All you got to do is go to medicalcodingbyjen.com, go to where are we going to? Tutoring. Go to the tutoring tab. And down at the very, very bottom is my $6 class. Just book that. So just go to the tutoring tab and then go to the bottom. And that's where the $6 Saturday class will be. You'll have a replay of that class, which was good for 30 days if something happens and you can't show up or can't stay the whole however many hours that I usually talk. I'm planning on doing 2 hours. I usually do 3. Just depends on what's going on um, in the household. But anyway, what do you guys think? Everybody says D. D is correct. It's a 2, which is unusual for unspecified codes. Most of the time, it's a 0 or a 9. All right. History, we don't need this question. This is an outdated question, so I'm going to skip this one. Medical necessary. Yes, good question for the CPC exam. Very good question. Okay, Medicare generally defines a service or a procedure as medically necessary if which of the following factors apply? Ooh, good question. This is a good question. I'm not feeling really ready. She's failing practice exams. Questions. Okay. Be sure, Sabrina, you are not running from CPT code descriptor to CPT code descriptor and trying to pick out your answers by just this code and its description. Don't do that. You need to go to the blue header, make sure you're doing and look inside your exam question. Am I doing an excision, which these answers are on one? Okay, we got part of it up. Let me get up the questions on Exam Edge in just a sec. Let me finish my YouTube thing because I can't see chat on YouTube yet. Yeah, we got the blue screen of death. Sorry about that, YouTube guys. Okay, let me open up Exam Edge again. Our practice questions. Over here, and we're going to go to Exam Edge. Which exam was I in? I don't remember. I don't guess it much matters. But that was a really good question. All right. Let me get this back up and this. Here we go. And let me get chat back in on the stream. Sorry, guys. I got to change source real quick and add in. Because it didn't save it or something. I'm not quite sure. Hop in chat. There we go. And go back here. And there is our next question, which is POA indicator. Probably not something that a lot of people would know for CPC, but if there's any CCS people in the house, that is something for you guys. POA indicators are in your HipHicks book. Anybody know that one? The Packers game starts at 7:15, so I might pop out early. Oh, you're going to leave me for that? Hey, Kyla. All right. Anybody know the answer to that one? I'm going to try to give away some YouTube memberships before chat or my computer crashes again. All right, let's hook that up. There we go. So over here, we're giving away on YouTube a month free of my YouTube videos, which have book prep videos, workshop replays, all that kind of stuff. Gave away 5 of them. I hope that is super helpful. If anybody knows the answer to this one, answer A, code Y, is correct for that one. See if I can't switch this to the next question. I'm going to skip that one because that's a CPMA question. That one too. Let's switch that one. Don't like that one either. Yeah, I don't like this exam. I'm going to go back and I'm going to start this one. Is that the one that I was doing? Continue. Yeah, that's why I'm in CCS. Why am I on CCS? That's why. Go back to this one. All right. There it is. There's the medically necessary one. All right, let me switch and go back to this. Here we go. That was a really good question. I found it. Medicare generally defines a service as or procedure as medically necessary if. You're welcome, Javon. I hope that helps you out. If we use Control F for quick search on cpcexam, if you use electronic books, apparently there is a search feature, right? So you can't hit anything like that on your computer because it'll zap you out of the exam. If you're in Scorpion, you know what we're talking about. But apparently, I had somebody take their certification exam yesterday or the day before, and when they took it, they used electronic books that AAPC provided. And there is a search feature, and they were able to use it to find any information that they needed. I have no idea. I've not done it myself. But there used to not be a search feature, and you just had to thumb through or scroll through to find the area that you needed. That would take way too long. But now that they've got that part of that system fixed, it sounds like it worked well for that person. Everybody's saying it's C. Correct. The procedure was not performed for a service, just for their convenience. Perfect. Other local lupus erythema, right? What do we think is our diagnosis code for that one? Would it be just the 3 digits, the L93, or would it be 0, 1, and a 2, the second digit or fourth digit on the end? Does this form of lupus need 3 characters or 4? And what would it end in? A 1, 0, or 2? We got 9,000 taps on TikTok and 28 people in. Thank you so much. Thank you for sharing the live. On TikTok, thank you. I mean, on YouTube, guys, thank you so much for doing the thumbs up on any videos you guys see on YouTube. That helps out so much. We got 1A and 1C. Anybody on TikTok know the answer to that one? That font is so tiny. I don't even know how I would see it, even on my cell phone. Ugh. You got to be able to see all the answers, though. Try to make it a little bigger, but Really not going to help very much. You're having a hard time and overthinking? Aw, probably. This one is again another 2. You remember how earlier today our last digit was also a 2? This one is a 2 also. Oh, we got a helicopter landing in the backyard. Okay. Chapter 11, which is your K00 in your ICD-10 book through K95. Which diseases are included in this category? Is it digestive system, skin system, musculoskeletal system? What is it? Yeah, that one's A. Which of the following is defined as the bottom portion of the trachea that splits into an airway to the right or the left of the lung? Another A? Yes. Another A. Good job. Another diagnosis code one. Here we go. There's another anatomy one. Which one of these prefixes or suffixes is related to bladder? That's a good one. Let's see if that's better for YouTube. A, B, C, or D? Indeed, B. Good job. The tissue layer that covers all of the front of the eye except the cornea. Hey, Twinkle, how's mom's doing? I hope she's doing better. You too, go kart. That is better. Okay, good. Covers up some of chat, but hopefully that helps. Oh, that's good, go kart. Might be able to make it bigger. Not too much. This one's D is in dog, all the way down to bottom because it does not include the cornea. Yeah, so no sclera. Which of the following is defined as the removal of plaque from an artery? The removal of plaque from an artery. C as in cat. Yes. A child patient is being treated for sores around the nose or mouth. Will it be a 3-digit code, 4-digit, or 5-digit code? And then if it is 5-digit, would this end in a 0 or a 1? It does say that it is identified as infantigo, but it's unspecified. Which one would be correct? C is correct. Good job, guys. A patient receiving anesthesia, asthma, anesthesia for a hip disarticulation. What would be our anesthesia code? Ten, 15, 12, or 14? Would it be not otherwise specified? C again for cat is our answer. Yep. What category would we diagnose somebody with pneumothorax? Are we going to be a J84, 86, 93, or are we going to be in a different section, which could be around E84? Thank you for the 37 roses already on TikTok. You guys are awesome. 14,000 tappy taps. What do you guys think is the answer? C? Yep. C again is the answer, S in cat. Good job. A physician says an area of a patient's body is prominent. What do they mean by that? Is it conspicuous, attractive, diseased, or drooping? Hey, Irina. Good to see you. We're just practicing medical coding practice questions, anatomy questions. Yep, A is your answer. Perfect. Good job. Which is which of these is defined as excising the covering of the larynx? Elena, hey, how are you doing? Good to see you, dear. Yes, D is the correct answer. D is in dog. There we go. Go there, and then let me open up the exam edge questions again. And go back here, do this. There's our practice question. Change our font somewhat and make it bigger across here of some sort. If we're dealing with these modifiers, modifier 90, 91, 92, and QW, which one is for single use transportable equipment or kit? Which one is for transportable kit? In our lab and path for a special single-use transportable equipment. I know you guys can't see all of the question, but I've got the answers up. It's 92. 92 does the is the modifier for a special single-use transportable equipment or kit in the lab. Okay. This one you guys can see all the question that you need. So for cardiovascular CPT codes, which one of these code sets is for our bypass graphs? But remember, you're doing non-coronary. Non-coronary. It's not C. Non-coronary. So we go to our first code set, starts with 3500 and goes down to 36s. So bypass graphs, starting here, where are we at? Way up here. Oh, down here it says bypass graphs. Starting technically. Yep. Right here at 35500. This one would be A. Yes, Kenesha, these right here. Answer A for these. Be sure to look for the non-coronary. These are not coronary. All right. Wrist anesthesia. Wrist anesthesia. Somebody's getting anesthesia with the wrist. We doing 0, 1, 8, 30, 29, 32, or 20? Whitney, you are correct. Bluey, you too. It is B. Good job. Brain stem stroke syndrome. How would you correctly ICD-10 code that, right? Would we be G46 1, 3, 4, or 7? Brain stem stroke syndrome. We are C. Good job. Perfect. Cellulitis of the neck. LO3.2. The interesting thing is some of our answers have 4 digits. Well, one of them does. The other one has 5 digits. And then the last 2 have 6 digits. That could be super helpful. Just knowing how many digits you need to have. They're all under LO3. Are you a 0.2 or a 0.3 is the first thing I would worry about. If you're a 0.2, are you a 0.2 and that's it? Or are you a 0.1 or a 0.2? 2. Cellulitis of the neck. Cellulitis of the neck. Cellulitis of the neck. Bring this over some. Cellulitis of the neck. What do you guys think? Good job, Kim. It is B. B is the correct answer. Perfect. The severity of the chief complaint is part of what? This is an old guideline. It can't be done now. This question is from guidelines written before 2022. So we'll have to skip that question. All right, what about this one? Which is defined as a stomach operation for the repair or a reconfiguration? Look at your prefixes and suffixes and which one means you did a stomach repair or a stomach reconfiguration. Good job, Whitney. Yes, it is the plasty. Good job. A. We can't do this one question either because this is an outdated guideline also. Okay. What about this prefix? Which one is the root word for lab and path? That means blood. Yeah, it is D. Good job. D is in dog. Tympanic membrane. Which of the following means tympanic membrane? 30,000 taps. Oh my goodness. Thank you guys on TikTok. Oh, the typos. I know. I do that even during my certification exam. I think I'm picking B, but I type in D or click the wrong one. I do it all the time. D is not correct for this one. It is not dog. Look again. It's not D. Good job. Oh, thanks, Go Kart, for the roses. We met our goal today. You guys are awesome. $50 roses from New York, too. Thank you so much for all the roses. Yep, this one is C as in cat. Perfect. Been a long day. I guess my brain is tired. Aw. Which cardiovascular prefix is defined as upon or above? It's sort of kind of correct. OT for, it's like which one is most correct, right? D was sort of correct. It's still correct. It's just which one's the most correct. As far as CPT codes, ICD-10 codes, those kind of things go. Upon or above? Yes, there you go. Okay, Meg. Yes, it is C. Perfect. Good job, guys. Which of the following connects the urinary bladder to the outside of the body? D is in dog. Yes, perfect. Excellent. HIPIC's code that is used for intensive cardiac rehabilitation with or without an ECG. What do you guys think? We gotta go get a different book for that one. We gotta get that one. I wonder if we can use the beginning of the book. No? Okay. Mm-mm. Probably could use the alphabetical index, though. Cardiac rehab. Ooh, that's kind of cool. Your alphabetical index in the front of your HipPix book, if you just go to the word cardiac, it will have rehabilitation indented right there, and it tells you what the answer is. It's kind of easier than looking at MO3 or going to MO3 versus MO4, but it's kind of cool. There are two codes. One of them is with the, okay, with or without ECG with exercise. One of them is without exercise. Our question has exercise. So the one with exercise is the 22, which is B. B is in boy. Perfect. Temporary codes in your HitPix book. That are required under OPPS for hospitals to use. Is it codes C, G, H, or K? I was just looking for that answer. It'll be on page 8 if you happen to have AAPC's Hit Picks book. Um, it's listing out in this second column codes C, G, Q, and K on this page. And then right there, it's talking about ops, right? And it's also telling you which codes they're talking about, which is our code C code. Yes. You have Optum, page 1, they said, Sabrina. Here's our diagnosis. Which diagnosis code is correct for that one? Would it end in a 2, 3, 4, or 5? Page 8. Good job, Bella. It is 5. It is L50.5. Good job. The root word that means cause. Which of the following medical terminology terms means cause? CAUSE. Good job. Everybody knew that one. D is in dog. Perfect. Intracranial hypertension. Which G93 would we be? I think I remember this code being on the certification exam. So this is a good one to look up. It's either G39 or 38 or 93. Something in these G's is on the exam, I think. That's very unhelpful, but what do you guys think the answer is? Will our diagnosis code end in a 1, a 2, a 0, or a 9? Is this specified enough? Oh, it does have the word benign in front of it. I forgot to highlight that part too. Benign intracranial hypertension. Can people with coding history of MVA with and bilateral below the knee, can you help with coding history of an MVA, paraplegia, bilateral below the knee amputation? What is she asking? Are we coding the MVA, the paraplegic, the bilateral amputation? What are we coding? Is that all one sentence? Is that one sentence diagnosis? Oh, and bilateral. This one for our benign intracranial hypertension is C as in cat. Which modifier are we going to use for separate identifiable E&M visit on the same day of a procedure? So for your query about history of MVA paraplegia, right? We're going to do unspecified, right? G82.20, probably somewhere around in there. And then acquired absence of the right and left knee will be Z89, 511, and 512. You got to do two codes because there's not a bilateral in that area. G8220 for paraplegia, unspecified, the acquired absences, yeah, of the legs. So that'll be Z89, 5, 11, and 12. And then if you're coding that car accident today, you'll have to do an S code for that and know whether it's subsequent or initial. So if today's the initial, it'll end in an A code. But all right, this modifier, right, is of course our 25. What's our anesthesia for an ankle replacement? Oh, thank you so much. The MVA is history of, and I didn't, oh yeah, okay, good. Anesthesia for an ankle replacement. 82, 86, 84, or will it end in a 40? Yes, you are correct. It is C. Perfect. Good job. BPH and the patient has a current UTI. Somebody's taking a coding course and has some fill in the blanks, huh? It'd probably be BPH with lower urinary tract symptoms, right? So in 39.0, sorry, or maybe in 40.1 for our BPH with lower urinary tract symptoms. Yeah. N40.1, somewhere around in that area. Yeah. All right. This one is C, our 1486. What about this diagnosis code? Our focal of the posterior pole. Very cool. You have to log off now, Kayla? Aw, me neither. I haven't eaten all day either. I need to go eat. When Travi is homesick, it's just very, very hard to do anything other than to play nurse with him. Oh, my Jamesy is messaging me. What's he saying? I don't know what he said. Oh, he's got 7 messages? What the heck? Sorry, my kid is messaging me. What is he doing? What's going on? Where is he at? Oh, not 7 messages. Then Travis has to be there at 4 p.m. Your delivery has arrived. Oh, yay. Frozen on YouTube. Oh, well. Yes, Twinkle has been tapping. There we go. All right. Here we go. Back to our Tiki Talk. Okay. So if we've got this ICD-10 and diagnosis code, which answer would be correct? We would have B as in boy, O2. We understand completely about having children who are homesick. Man, they're killing me. He's killing me. And it's different when it's not like just a cold or flu and it's something that could end up being very, very, very serious or life altering. Once, if he has to have surgery for this situation, for his arteries being messed up, that's like lifelong issues. As soon as you cut into the body, you've got lifelong issues. So it's a huge decision to make to do something about this stuff. Not that we have much choice when arteries are involved, but it's still stressful. All right. What about a patient with severe systemic disease? Would that be a P1, a P2, a P3, or a P4? Come on, TikTok. Y'all can focus in better than that. I don't know why you're like doing all the lines on the TV screen. Looks crazy. If we have severe systemic disease, does that mean we're P1, P2, P3, or P4? This is an anesthesia question. Bluey says C. Kanisha says C2. That is correct. It is P3. Good job. What is the anatomy term that means surrounding? Okay. Sorry, guys. Had to message Twinkle. It's too funny. All right. It's funny. I think it's funny. It's cute seeing your name over and over again. Yes, this is C. It is Perry. And I'm sure it's helping out getting the word out. We got 44,000 tappy taps. That's awesome. What is meiosis? Of the forearm, the right forearm. What would be the diagnosis code? Would it have 4 digits or 6? And would the ending have a 1, a 9, a 3, or a 2 in it? What do you guys think for this one? We had 7 shares of the live. Thank you so much, guys. We got 31 people on. That's awesome. So much fun. What do you guys think about this meiosis of the right forearm? What would be our diagnosis code? Parker are on. I bleed green and gold. Aw. We take football serious in WI. I miss those days when I was a kid. My papa, my dad's dad, loved college football, and we used to watch the Tennessee um, play like the Arkansas Razorbacks or something like that. That was a lot of fun. The guys would be hollering at the TV. Too much fun. This is A. A is an apple. Good job gardening. You did a good job. Hey, Levine, how are you doing? Good to see you. You're in Milwaukee, Wisconsin too, gardening? That's awesome. All right. Which one of these codes would be used for a home care assessment of a newborn? I hope these codes are still valid. You guys have got to tell me. These codes may not still be valid. I'm not sure. Oh, can you find the 99502 codes? Do you know where they're located? Or the 99183? Can you even find them? Kanisha, you are correct. Good job, Bella. Yes, it is D. Perfect. We only got 33 on now and 27 on YouTube. What about urine loss due to stroke or dementia? We're going to have an incontinence of a patient, right, that has urine loss due to a stroke or dementia. Incontinence, that is defined as urine loss due to a condition such as stroke or dementia. Would that be any one of these four? We use 99601 in your doctor's office. Yeah. Lots of policies are different than guidelines are in our books for sure. You will, based off signed contracts with your vendors, local hospitals, with local home health agencies, with even labs, um, you may code or bill totally unique. The group that I worked for in California never did a claim for any lab work because we did a deal with LabCorp. No matter how many patients we send to you, you're going to run their test and send us the results, right? But we'll just cut you one check once a month for no matter how many tests we run on all of our patients. That way we don't have to do individual claims for every single patient, right? Causes them paperwork, us paperwork. We just negotiated a deal, right? And that's the way we did it. So there was no claims or having to code for lab work. So diagnosis codes never meant anything for that. So it was kind of cool. Never heard the term. This is functional. Incontinence is a function issue, not an urge issue, not a stress issue, and not an overflow issue. These are words used to describe urine complications, right? Urge, stress, overflow. Incontinence is a functional issue. So D is the answer. A patient receiving anesthesia for a cesarean hysterectomy following this type of labor and anesthesia. What would be the correct code for our anesthesia? Indeed. D is in dog. Perfect. A radiological position That means that you're laying down on your back with your face up. On your back with your face up. What would that be? Indeed, it is B, supine. Perfect. Initial observation care within a hospital typically lasts how long? Think about how long some of this stuff is. And two of them technically are similar because they have the same answers in them, sort of, kind of, sort of. Well, 24 is in three of the answers. And then two of the answers both have the number 48 in them. So your correct answer is C. 24 to 48. They usually try not to keep you 3 days, right? They try to admit you one day and get rid of you the next day. They don't want longer than 48 hours, Anyway, add-on code for controlled hypotension an add-on code for anesthesia that means there was a complicated utilization situation going on for controlled hypotension. Oh, yeah. It's a good question. Thanks, love. Love is my fragrance. That's awesome name. Love that name. This is C as in cat. Yes. RBRVS, the physician work component, accounts for what percentage of procedures and services total relative value? Is the percentage 52%, 44, 4%, or 30? The physician's work component. More of a billing question, not really CPC, but what is the value of the work the physician does? Because if you have to separate and do the 26 modifier and the TC modifier, because you need to separate out that procedure and only pay the facility for a little bit of it and then the physician for their part in it, what would be the split? The building TC would get what percentage, and then the physician would get what percentage for their brain and no power? The brain, you think doctors would work for 30% of a procedure? Let's say a procedure is $10,000. You can get a physician to come in the door and work for 3,000 to do, I don't know, a 2-hour procedure. What do you think they'd want? The physician has to go to school for 12 years to become a physician and be able to do a surgery or procedure. It's not like it's a family practice doctor or something else. It's this, we're talking about components of procedure. So the neurologist who's going to cut on your brain, if the R value of a particular CPT code, what do you think the physician, for their time in school and practice hours spent in labs and things on cadavers or whatever, would be their cut? Yeah, think about it like that. Just having a facility, turning on the lights, or owning the robot equipment will get you 48%, but the physician will be paid 52%. They wanted that little bit over the 50% mark, right? So just think about it that way, that physicians don't want it split 50-50. They fought and paid for a lot of Congress people to make their part of the payment more than the hospitals. There's a lot of legislation that went in on that, and a lot of kickbacks to get that 52%. All right. Diagnosis code for adolescent idiopathic scoliosis. Which one would it be? Would it end in a 6, a 2, a 4, or a 7? That's a good way to think about it. Yeah, I have to associate things. If I'm going to remember it, then why would I remember 52? What does that mean significantly to me? So I have to think about it that way. I have to draw a picture with things, and I can visualize that in my head. It is A. Good job. A is an apple. Good job. Oh, I forgot to tell you guys it was lumbar region. That was important. Which one of these regions is considered the groin area? So I graduated from my school, but they didn't tell me that I didn't get my associate's degree, and I get certified even though I only have a certificate of the course. Yeah. Certificates of courses won't get you a job. You need to get certified through AAPC. You are never required to get a course to become a medical coder or biller. You can do this self-study without a course. You don't need an associate's or whatever to get into this career field. You just need to pass one exam to become certified. When you are certified, there's continuing education that you have to do to keep it, and you have to pay your membership dues to keep your certification. Other than that, you just need to pass one exam. So yes, it is okay that you do not have your associates. Correct. That's fine. I know, Glory. Miss Lopez, all you needed to do was pass the one exam. I self-studied for all my certifications. I have the CPC, I have the CPCI instructor, and the CPMA, all without a course. You just need to get the study guide from the place that you're getting your certification from. So if it's AAPC, pick your certification. If you want to be a certified professional coder, then get that study guide, get their practice questions, and just self-study. You have to pay more school. Yes, you only have to pay for the exam, but you have to pay your membership to AAPC. If you're doing CPC, right? Your school may give you some sort of discount for sitting for the exam because they send so many students to AAPC. They may have gotten a discount, but you have all the books. Perfect. That's great. So you need an AAPC membership. The first time that you get a membership during a course, it should only cost you $175. But if they don't offer that, then that's $220. And then you can purchase your 2 exam attempts, and that's $500. You get 2 attempts at the CPC. Take the first one right away. If you don't pass, then you can study with me for free, and I'll help you from the exam point of view. Today was just crazy. I got drama going on in my house and didn't prepare any exam questions for you guys. Normally we have something a lot better, but yes, the answers are inside the book for this one. Inguinal is your groin area. If you are in the AAPC version of their ICD-10 book, right, you will find your answer probably right before your pink section, right, where they discuss um, all of your body parts, right? And they have all these 3 anatomy parts, right? You could even go into the digestive, which is K, right? And A B C D E F G H I J K, and in our digestive system, they're talking about the anatomy, right? And your liver and pancreas and all this area. They do talk about hernias being in the groin area, inguinal, those kind of things. They've got lots of anatomy inside your ICD-10 book. In fact, if you get AAPC's version of the ICD-10 book, all the anatomy you ever wanted to learn and need to know for your exam is in here. Not that I want them to make more money. I'm just telling you that it has that anatomy component in them. All right. COO to D49 is what? What's going on in chapter 2 of your ICD-10 book? Is that infectious parasites, neoplasms, blood diseases, or metabolic issues? Do you think the CPB study guide is beneficial for taking the exam? Of course. If it's the CPB study guide written by AAPC, yes, absolutely. I have the course um, that I purchased, and I just haven't taken the course yet. I need to do that, but I haven't done it. It's been sitting in my Blackboard for 6 months. I've taken 10 of their courses already, but didn't need them for any of my certification. I just like taking them to see if there's anything in them for you guys. All right, this one, everybody should know this one is for neoplasms, B, correct? All right, which is defined as radiation placement in or near a tumor within the body. Any tips for CRC? I'm trying to take it and decide if that or CCS is better for inpatient. That was TikTok. Okay. If you go to my website, Medical Coding by Jen, go to your drop down menu, scoochy down here. I have CRC right there. Just click on it and scoochy down. I've got my notes for the CRC exam and a workshop replay that we go through 100 practice questions in 4 hours. Um, for the CRC exam, you can watch that replay, and then this is a copy of all my notes for the CRC exam that I put in my ICD-10 book for exam day. So those two things are available for you on my website. I also have an $8 membership on my website if you want even more practice exam questions for risk adjustment, which is right there under risk adjustment right there. If you click on that and get that membership, there's a ton of online practice exam questions that are interactive right there. All right. A ton. I bet I have 1,000 on that page. It's crazy. Plus a bunch of instant downloads. This one is D, bradycardia. Yep. Brady therapy. Sorry, why am I saying cardia? You always say bradycardia when you say bradia. It's one of the, they just go together. But we're doing BRAC therapy. I just can't read. I'm just barely skimming the available answers and just assuming that's what it said. All right. What about this diagnosis of the right hand? Is our diagnosis code going to end in a 9, a 2, a 1, or a 4? One of our available answers is 5 digits long. The other ones are 6-digit long. So, where I'm doing these questions, if you go to my website, Medical Coding by Jen, go to my website, and if you go down to the little lady's elbow, I have the links posted right there. You can go to Pocket Prep right there, where we have access to 750 practice questions, or you can go to the second one right there, where we have access to 1,000 questions in 100 exam question little things like this. And these questions aren't as lengthy as normal practice questions, but they're good practice but they're short little sentences, right? Pocket Prep's better at creating scenarios more like the certification exam. But if you're just beginning and really wanting to know and learn the differences between your codes and figure out what's going on before you tackle cases that are confusing, this is super helpful for sure. If you do use the links, it does help me out and reimburse me eventually for your guys' clicks. And that money I give right back to you guys, but with YouTube memberships, even just having my website holding all the information or Discord, those things are not cheap. Just the annual membership to have a website to hold information for you guys is over 1,000 a year. It's crazy, but you know, all those little clicks does help. And somebody else is paying the bill. So that's kind of cool if y'all just go there and click. All right. This one is C. Did you guys get the 1 code for the right hand? Remember, if your diagnosis code ends in a 1, then you're dealing with the right of something, right? If it's got right and left. If your diagnosis code's in a 2, then you're dealing with the left, right? And then if you're dealing with bilateral, sometimes it's a 0 or it's the number 3. So just looking for the right and looking for the only answer that has the 1 in it, you'd have it right and you wouldn't even have to open up your book. I like it when we're dealing with hands and feet. That's always nice. Let's see. HitPix code set used to identify services that would not be given a CPT code or are not identified by the national level 2 codes, but are needed for CMS to facilitate claims processing. Are we dealing with codes like Q, S, T, or A for facilitating claim processes in our HitPix book? Anybody know the answer to that one? Good job, Amy. Yes, you are correct. I got somebody on TikTok's got it right. Anybody on YouTube? T codes, I think those are the temporary codes. So these would be your Q set of codes. But I guess that is kind of like temporary codes also. I don't know, I guess they all are. Which one of these definitions is the definition for embolism? Is that MI, a stroke, vomiting, or blocking? Yeah, that one's A. Perfect. Um, Character extension for M80 for subsequent encounter. What would be the seventh character for a subsequent encounter for a fracture with routine healing at M80? M80, subsequent encounter for a fracture with routine healing. M80. No, the test is not this straightforward. Not at all. If it was, we'd all pass by now, right? This one is not answer A. Answer A is always initial, right? We're doing subsequent encounter for a routine fracture that is healing. I know, right? Gardening, I wish. TikTok, we love you. I like that name. Hey, Pennywise. This one's K. It's D down at the bottom. Fractures are always unique. You got to go to M80 and find your seventh character and look for the correct type of fracture. The act of purposely billing items or services that were never delivered to a patient, is that known as fraud, falsification, abuse, or cloning? If you guys want to join me in a live Zoom lesson, I have one this Saturday coming up for only $6. Just go to my website, Medical Coding by Jen. Click on that menu tab at the top. Get the drop down menu to come down after you hit the menu tab. Go down to tutoring, click on that. And when you get there, at the bottom is my class for this Saturday. It's $6. I have or am preparing questions inside there for you guys on Saturday. I'm going to send you to your device 3 questions, and you won't see anybody else's answers in chat, right? You're going to answer the quiz all by yourself, and then we'll go over the answers, and you'll be able to see your grade. I won't, nobody else will, but you'll be able to see how well you did by yourself without chat room, right? We'll give you 2 minutes per question to do them. So in 6 minutes, you'll have done 3 questions, and then we'll go over them in a live Zoom video. You'll also get the replay of that video, which will be good for 30 days if you do the pre-purchase of it for $6. So I hope to see you guys there on Saturday. This one would be A. It is called fraud. Perfect. Which cardiovascular suffix means membrane? Yes, this is a whole quiz of 100 questions. We've done 57 questions so far today. I skipped a couple of them because they're outdated questions. I bought these questions probably in 2021. So, um, I think if you buy the new set of questions today, you won't have any missing or out of date guidelines, I'm assuming. But I bought these several years ago. So, um, There's a couple of them where the guideline's wrong. So I've just been skipping those, but I bet we've done probably 52 questions or so. Yes, indeed. A is correct. Thanks, Go-Kart. When determining a patient's HPI, we can't do this one. This is one of the ones with the guideline. We don't do HPI for E&M anymore. Thank the maker. Oh my God. If we had to do HPI, that was the worst. Okay. Rheumatoid lung disease with rheumatoid arthritis of multiple sites. Where would we be? Would our diagnosis code end in 7, 9, 0, or 5? Is multiple sites unspecified or EC, NEC, or NOS? When we don't have like right lung, left lung, which lobe, those kind of things is what they're trying to see if you know which one you would code. Correct. B is correct. Good job. Chemotherapy delivered to the central nervous system would be coded either with a 40, 46, 50, or a 49 if it was delivered by spinal puncture. Which one would it be? Almost 50,000 taps. Thank you guys on TikTok. That's awesome. Chemotherapy delivered to the central nervous system via a spinal puncture. That looks better. Thank you, TikTok. $49,000 tappy taps. Indeed, Margaret, it is C. Good job. The modifier for lab and path when billing an outside reference laboratory. It's not C. We had a question earlier today, and 92 was the answer. This one isn't. This is going to be done by an outside laboratory reference lab. Yes, it is A, number 90. If we're using this, which procedure are we coding? What do you guys think? Are we a 39, a 40, a 56, or an 88 for our last two digits of our CPT code? Gotta reverse our camera. Hmm. So many freaking options here. It's like, what are you talking about? What is this? I know the order. Yeah. Rotate 180. Is that better? Is that still backwards? Still backwards. Don't need it to rotate. I need it to flip horizontal. There we go. Good Lord. I had to flip it horizontal. Phew. Been backwards all dang day. We're doing any medical coding certification exam, any of them, really. This one is B. It is a 40. Gallbladder. Which one is for gallbladder? Yep, that's better. It's been a hot mess today, just like me. The stream, I mean. Yes. Oh, we're missing our little girl, is what we're missing too. We're missing her. Let me do that over. Yeah, there we go. We got her back. Now you got me talking at the same time. To reboot the computer 3 times and redo settings and stuff. It's crazy. Yes. Our answer is B. Good job. Personal history. Is that a Z2, a Z1, or a Z8? Where would we be in our diagnosis codes? Is the class this weekend a whole test? It's 2 hours. It's whatever you guys can do in 2 hours. It's not, we're going to do 3 questions at a time, and I'm going to send you the exam questions, and you won't have access to chat, right? And you're going to actually pick A, B, C, or D, your own individual quiz. And then I'll hit grade, and then you'll see the answers, right? And then we'll go over the questions. So it depends on how many questions you guys can answer, and I can get through the less questions that you guys have about the questions that I give you, the more we can do. But it's going to be whatever we can do in 2 hours for $6. So it is great value. We usually end up going closer to 4 hours, 3.5. It just depends on my stamina and what's going on. And as people start dropping off and people start saying they got to get back to their families, and people lose interest, of course I'll stop too. So it just depends. but I guarantee 2 hours. For sure, for sure. Yep, we are D as in dog. Good job. Lower left eyelid. You're welcome, Nicole. Thank you for the heart me, Victoria. I go soon to take my test. That's great. I hope I can help you out. Everybody got B? Good job. Anterior, transparent cover of the sclera, component of the eye, is what? Anterior, transparent cover of the sclera is what component of the eye? Timing. Yep. Getting through those pages, knowing where to go. You need to have a plan of attack. Go straight to the answers. Look at your available answers. Have a plan of attack. You've practiced so many in Tigmatary. When you're there, you know what you're going to go do. Same thing for cardiology. Same thing for ICD-10 and HIPICS. Plan ahead. What are you going to do? What are you looking for in those available answers? Tay and Bella, correct. It is A. Good job. Which set of code sets, or which set of what code set is used for esophageal scopes, right? Look at your prefixes, your root words, those kinds of things, and then go find your code set. Some of them have gastro in them, some of them have cysto in them. Know the differences between your root words. Aw, the class is so good. Aw, that's awesome. It's my kids coming home. Ophine, Sun and Moon, good to see you guys. Which code set are we talking about when we're doing these scopes? Indeed, B is the answer. How is that? Did you do the whole practice or did
No,
you?
I'm not on the comp team anymore. I'm just an alternate. She took me off. But she understands she didn't. But she even let me stunt today.
You're not going next weekend?
No, I still have to go, Mom. I'm an alternate.
But if she took you off the stunt team, then
No, she took me off comp. I can't stunt today for a couple of weeks. For a while.
What do you want? What pain meds do you want?
Everything.
You want everything. Okay. Sorry, guys. Hold on just a second.
Low relic.
Oh. How many of it? 1 to 2. You can take 3 times. This is your last one of these. You can't take any more of that one today. Hold on. Do you want the one that they gave you the shot for in the IV? Okay, we don't have access to these anymore until we see what Fredo. You have 4 left. Let's cut it in half, okay? Because that's all I got of those.
Do you have any more pizza left?
Yes, let me cut this one in half because I'm not sure if they'll even write this one anymore. How are you an alternate when you're one of the guys who tosses the girls in the air? I don't understand that. I know that. Go shut the door.
So
8 in the morning?
mm-hmm.
Why are they making us get up at 8 in the morning when we don't have to go to freaking school?
Mm-hmm.
That is rude.
Yeah, we have practice.
That 8 in the morning when you could be sleeping in? Come here, Travis.
Travis.
What?
It broke apart, but all those little pieces you can lick, okay, and then drink.
Huh? What do we have?
Okay, guys, I'm back.
Yeah,
E2 is correct for this one, for lower left eyelid. Sorry, guys. Okay. Unlisted chemotherapy procedure is which one?
I see you get a Walmart. You gotta get these ones because these are super good. Like these.
Okay, but you can't like drink all of them tonight. They're not for you, right?
I know.
Okay.
I'm just grabbing it to give you an example because I don't. Just there.
Can I see it again? Oh, yeah, those are expensive. 4 for like $20. It's crazy. Got C's and D's for you guys. I do these every Monday. Every Monday. She's got to go to Phoenix. It's 5 hours away. All right. This one is D as in dog. Yeah. Unlisted procedures usually end in number 9. Yep. Hey, Travi. Did you tell Coach what you had? That you have the thing in the gut that I gave you?
Like the
SMA. That's what you have is SMA. Superior mesenteric artery that's being cut off.
Oh my God! What were they at?
Tomorrow, everybody needs a ride to practice. Travis, they're saying they need rides to practice in the morning. Kendall doesn't go, right? Okay, and so that means we gotta leave the house at 7:15, Travis. Unless we're going to McDonald's. Can we leave at 7? Good. Okay, I shut my bedroom door. Sorry, guys. Cardiovascular combining form. that means the word hard. It's not vain. Try again, Teresa. Which one means hard? It probably didn't show up as looking for that correct word in the question. The way they write these are some kind of weird. Which one means hard or hardening? Good night, Bella. See you guys later. Hardening. Hardening. Myo could mean muscle or nerve. So it's not A, it's not B. And PHL, we're dealing with lungs. So sclera, hardening of arteries and stuff, like sarcoidosis and stuff. S, yes. Okay, what about the outer portion of the disc between the vertebrae? The outer portion of the disc between the vertebrae. Mm. Try again. C4. Try again. Try again. It's not A either, guys, on YouTube. It's not A, Tay. Try again. This one's B. Good job, Bill. It is B. The outer portion of the disc between the vertebrae, right? That's our fibrous, commonly, outer portion of the disc. It has several layers of fibrous tissue that encircle and it's like insinuous tissue that encompasses the nucleus pubis thingy right around your bones. All right. Key root word for pathology and lab meaning disease. Which one means disease? Yes, perfect. This is C. Excellent. Good job. CPT code for organ or disease-oriented panels. Which one are the panel codes? The panels have the 2 zeros in them, right? Because I like to pretend and make a smiley face right underneath them when we're doing the panels. right? So remember the second and the third digit in the 5-digit CPT code. If they ever ask about disease oriented anything, you know your second and third digits are just zeros, 2 zeros. So answer is always A with this one. Yeah. Which CPT code is for that procedure? I have fun with this one in our CPC course. I'm teaching the CPC course, and we like to work through the practical applications inside the class together. And when we do that, this one reminds me of astronauts looking in windows. So we have fun doing those practical applications together. This one always trips me up because the CPT code descriptors are very vague in this area. Will our code end in a 39, 40, 56, or an 88? Yes, this is being recorded live on Tube of the U. You know what I'm talking about? It's over here in this area, and we've already been going for 2 hours and 32 minutes, and it will be recorded there. And you can even replay it starting now or anytime you want. The replay will always be there. I have the date, today's date in the label, saying what today's date is and what we did so that you guys can find whatever lessons you guys are looking for. Yes, this is C. It is 56. Good job. There's another vocabulary term. What do you guys think is our correct answer? Do I only have 3 answers showing up? I only have 3. How do I get all 4 to show up? There we go. Did that work? Sorta. Okay. There we go. You're welcome. Kanisha, good job. The answer they want is just simply the uterus. The uterus. This is a code or a question that would be answered by the PCS people or CCS people in their PCS book. I think. Or is this a diagnosis code one? No, this is diagnosis code. Why am I thinking it was PCS? This is indication of psychological abuse complicating a pregnancy. So, would we have 3 digits or would we have 4? And if we have 4, would our diagnosis code end in 3, 4, or 5? Yeah, I gotta fix the date on this one. I put October. I keep thinking everything is Halloween month. One of my kids have a birth date in October, so I'm I get set in my ways of typing that date all the time. November is such a short month, it'll be gone before we know it. And then it'll be December. Oh my gosh. Where did this year go, guys? Where did it go? All right, this one's going to end in number 5. C. C is your answer. Also need to know and add what type of questions we did. And last, probably 3 Monday Lives, I don't think I wrote down what type of questions we did, like if it was anatomy or ICD-10 or hip picks or what we did. I need to fix those too. I'll do that when I end today's live. Patient with chronic kidney disease with a filtration rate of 93. Would that be stage 1, 2, 3, or 4? The higher the number, the better your kidneys are working. I'll let you know that much. This year is almost gone. It is. It is a stage 1. Perfect. All right. Spondylosis of the lumbar region. Where would we diagnose code that? Would it end in a 9, a 7, a 1, or a 5? Yes, B is correct. B is in boy, the one with the 7. What about this disease? How would you diagnose code it? Would the 5th digit be a 2, a 4, a 9, or a 1? Still got 37 of you guys on Tube of the U and 25 of you guys on TikTok. We've got 51,000 taps on TikTok, 4 roses now, 12 shares. Thank you guys. All of y'all's engagement, tapping, liking, sharing, copying links, all help out a whole bunch. This one is D. It does end in the 81. Perfect. All right. If a patient has hereditary nephropathy in not elsewhere classified with diffuse mesenchymal proliferative, are we going to end it with a 2, a 6, a 3, or a 9. This is hereditary. Kanisha.
Kenshia Rogers has become a member.
For 10 months. My goodness. Almost a whole year. Thank you for supporting the content. N07 point what? This one is not D. We are specified. Sort of, kinda. This one is hereditary. NEC. That means we have too much information. Not elsewhere classified, meaning we have the E in the middle. Means that our doctor has given us too much information to code. So we're not going to end in 9. It's not B either. We're not going to end in 6 either. Good job, Sarah. Yes, we will be C. End in 3. Yes, C. Perfect. Which of these describes that? The last time we had a question in this area, the answer was just uterus. But most of you guys were trying to pick a different answer. And that answer is the answer for this one of all things. I don't know if that's helpful, but yes. Ty on TikTok, you got that correct. It is D as in dog. It includes all of this stuff, including and the urethra. I just don't know how many words I can say here, but it does include the urethra, that one. All right. When we're doing these scopes, endoscopes, which set of codes are we talking about? Will there be any changes in patterns for early 2026 CPC exam? No idea until somebody takes it in mid-January. I don't work for AAPC as far as an exam creator. I am a licensed instructor for AAPC, but I do not write their certification exams. And I am not privy to the meetings about that exam. So until one of my students takes it, and then I start watching the comments being posted on Facebook or wherever, where people post their experience of the exam and how it went, that's the only way I can find out. I have no idea. I assume it's going to stay the same and still be all multiple choice, because if they were going to update it and have any fill in the blank, they would have notified us by now. So my assumption is it's still going to be 100 questions. It's still going to be all fill in the blank for 2026, if that's helpful. Hopefully that's helpful. But as far as if there's going to be any differences to what I consider questions that are most frequent on the exam, don't know yet. But I do have my boot camp that is 8 hours long that does tell you my predictions per section of what I think you will see on your exam. People have been watching that one day and then taking their exam and passing it with high scores in the low 90s to high 80s just with that, because they knew pretty close of what type of questions to expect and stuff like that and how to handle them. This one is A. Everybody got A for this one? This one's weird. Be sure to mark that in your book because they technically don't call endoscopes in your CPT books. Sometimes they call them laparoscopes. This one's pretty difficult. But then again, when it's in your CPT book and it's called a laparoscope, the CPC exam question says it's an endoscope. And then people get confused as to what the hell's going on and which code do they pick, right? So this is a really good question. Go mark these codes as either being called laparoscopes or endoscopes. Very cool question. Flaws in a lens are what? Yeah, if we have any questions that come up that we can do any with the process of elimination, I'll explain it. If you do go to my tube of the U and you click the little magnifying glass under my full list of videos and type in the word elimination, it'll bring up all my videos. I have one video that is like 4 hours long, and every single question, I quickly do the process of elimination with it. That's a really good video, and I did it for free for everybody. Yes, this is B cataracts. Perfect. Which is a group educational session conducted by a physician. You're welcome. You're welcome. You're welcome. You're welcome. What was that with YouTube? What happened? A is your answer for this one. A. Group education by a physician. All right. What about a condition in which an organ is turned inside out? Which one is that? What vocabulary term means that? You watched all of them? Great. Perfect. This one is A. Panoramic radiology image of an entire, let's see, bone structures all in one film. Huh. If we're doing of a bone, we're not histo, right? That's fallopian tubes. My means muscles. So it's either C or D, right? P or an O. Yeah. Ortho. Yeah. Whoops. Let me go back and click that properly. Which one means droop? Yes, it is D. Perfect. Good, good, good. Which diagnosis code is for seb infantile dermatitis? All right. Will we have 3 digits or 4 in our diagnosis code? If we have 4 digits, is this NEC or NOS? Would we be an O or a 9, or is it specified enough to get our 1 diagnosis code? I can hear the S word in my head, but I cannot get it to come out of my mouth. I can hear it as clear as day being said, but I cannot get it to come out. That's so weird. It's so weird to hear it pronounced inside my head clearly, and then my body will not say it. Oh, weird. I wish I knew what that was. It's not astasia, because I'm not coming up with a different word than what I'm thinking in my head. It's just the inability. It's weird. Yes, we are D, as in dog. Perfect. Good job. Suturing is which one of these? Indeed, it is B. I love those 2 R's. It reminds me of somebody stitching. Love it. Which code set, diagnosis code Y, is for our mail system? Is it N's? I don't know what these 599s are for. N's or Q's? Maybe they're ICD-9 codes. I'm not sure, but what do you guys think? Yes, it is C. Perfect. Which CPT code is a photochemotherapy that is used for psoriasis that is usually done in an inpatient setting? All these numbers are different. Two of them start with a 9-6. The cheaper of the two is 960, which is A. But since they're all in the medicine section, the easiest thing to do is just to turn to your index thingy that we have in the beginning of our medicine section, right? And we just look at our headers of our codes. 960, I don't remember chemotherapy being in those number sets, but 960 is motion analysis. That's not photochemotherapy. 969, where are those codes at? 969. Special dermatological procedures. We are doing severe psoriasis, so that is dermatology. So maybe B. 97750 is ortho something management training and prosthetic training. So no, I know we're not C. And then 98969 is under telehealth. So I know we're not doing telehealth inpatient hospital chemotherapy. So the only thing that's got dermatology listed in our medicine index, right, is B. So I know my answer is B. This is a lot easier than flipping through the whole medicine section all over the craziness, you know. I like using the beginning of the chapters and just looking at your headers for your code sets and picking out my answers with this. But yes, B is correct. Root word for sleep or numbness. Does anybody else use these indexes for the numbers in the CPT codes to do practice questions? Or do you all just run to the codes and the CPT code descriptors and do it? Sometimes I like to. Okay. Hey, Daisy, thanks for the follow. Yes, go kart. Just curious if anybody else knows how to do it or uses it. What's our root word meaning sleep? Which we probably all should be doing right now more often than before. Good. It's always fun to practice. Narco. Yeah. Narcolepsy, right? Sleeping. Yeah. Perfect. This one we can't do because the E&M guideline has updated. So I have to skip this one. Technically, no, it hasn't. Sorry. That one is not updated. Which E&M set of codes requires extensive documentation to support the code? General progress notes, nurse visits, routine office visits or new patient visits? Yeah, it's new patient. It's not default. If you don't know if a patient is new or established, you have to code established. You have to be able to prove your patient is new to you to be able to bill it. So that's all they're talking about in that question. All right, we got 6 more to do to get all 100 done. D50 to D89 covers what type of diseases? What type of diseases are being done for D50 through D89? Yeah, endocrine doesn't start till E's. D's are blood or blood forming organs or immune issues, right? Blood diseases. Yeah, that's going on in our D50 to our D89. Which prefix means the term against? Contra. Good job. Home care for ventilation management is what code? Hey, Debbie, good to see you. Correct, Kim. It is B04. Perfect. What about images done of the bronchi of the lungs using contrast? What would be the name of our procedure? Indeed, Tiff, it is A. Perfect. Easy peasy one right there. If we have a female pelvic peritoneal adhesion post-infective, what would be our diagnosis code? Would it end in a 5, a 9, a 6, or a 3? Do we have unspecified information? Or if it is specified, is there a correct diagnosis code for that specific issue? Super fast. Hey, minivan. Go kart, thanks for the roses. Jackson, good to see you. Thanks for tapping, tappy taps. We got 35, 50, 53,000. Sorry, dyslexic. 53,000 tappy taps. Yes, this is D as in dog. Perfect. Ends in 6. If we're doing an examination for alleged child abuse, would we have a T code or a Z code? If we have a T code, would it end in a 4 or a 6? And then if we have a Z code, would it end in a 1 or a 2? I remember something about there's differences between ICD-10 codes, whether it's the perpetrator versus the victim. So there's a difference somewhere. I remember that. But this is for the examination and observation of child abuse. And they're saying suspected. So you can't say they do have abuse, which would have been an injury code, which would have been like an S or a T code. So I think that's what they're wondering is you can't say they do have it if they've got the word alleged in there yet. So you can't give them an injury code. We've got alleged. So I bet it's a Z code. So just those kind of things you got to watch out for. It's a good question for the exam. Yes, we would be a 72. It is D. Good job. Medicare covers inpatient hospital care and provides skilled nursing under which part? A, B, C, or D? Yep, part A. Perfect. And end exam. End and grade. What does that mean? Yeah. I didn't answer 6 of the questions because I skipped them. So all the ones that we did, we got correct. So pretty cool. All right. I hope this has been helpful. Again, if you guys wanted to do these questions, they have 10 of these 100 questions that you guys can purchase. And I think it's like 30 to 40 bucks, something like that, depending on the coupon code that's good for that day. I bet on Black Friday coming up pretty soon, they'll have a good sale. But if you go to Medical Coding by Jen, scroll down to the little lady's elbow. These were Exam Edge, 100 questions per exam. So they have 10 of those exams. And then Pocket Prep is right there. I like Pocket Prep better because they're giving you more like what's on the CPC exam, right? There's a whole scenario. Bob fell out of a tree. He did this and did that yesterday, and today the doctor is going to do this stuff in there. There's a lot of propaganda in those questions, right? These questions are more straightforward, right? One sentence, what's the answer? But still, they're okay. And if you use the link on my website, main homepage, I get a little something for your guys' just clicking on those. So that's always nice and helpful. This was helpful as usual. Aw, thanks, guys. I hope this was helpful. I have tutoring set up with somebody on Thursday. I'm fixing to email that person because of Travis' condition that we found out about in the emergency room Friday. He's got this arteries, two arteries that are blocked, like they're the main arteries for blood supply. It's a big deal. I gotta go to Vegas to get him seen on Thursday, so I need to move that tutoring around. I don't know who it is, but I gotta go. They're usually whoever schedules tutoring is usually in my lives, you know. So if it's you, expect an email in just a second. Let's see what day we can do your tutoring. Maybe tomorrow after my class or Friday. So anyway, um, just a heads up on that. I love you guys. I hope this is super helpful. I will have another free live lesson, The Powers to Be Willing, on Monday. I've already got the link up on the Tube of the U so that you guys know what time and everything. I'll get this header for our replay fixed as soon as I end this live. Thanks for hanging out with me. Yes, please send good vibes to Travi. This is a girl issue. This is like 91% of people that get this very, very, very rare condition are girls. So I wonder if he's like very unique. Like I've seen a few of light skinned guys get this, but I'm like, why, Travi? This is very interesting. It's too funny. I swear it's because he's hanging around with these cheerleaders too much, right? He's getting a girl syndrome from the girls. But anyway, it's too funny. I'm interested to see if this um, heals on its own, which would be lovely if it does. It has sporadically healed on children um, spontaneously, but we'll see. We'll see. I hope so. I hope he has the best results with this and does not need surgery. That would be great. But yes, any good vibes you guys can send. Also, go karts. Got two family members who have been sick or recently in the hospital or still in the hospital, and so has Twinkle. So, all three of us, you know, that have been here every day, every live, that are in Discord, that help you answer questions during chat and are in these live, all three of us currently, right now, have kind of weird, interesting, um, important, and significant health issues going on with significant family members. So send happy thoughts to everybody associated with Medical Coding by Jen. Love you guys. Y'all have worked miracles before. You helped my cousin, who is a police officer in Tulsa. He ended up with a aggressive brain cancer a couple of years ago, and he has been off chemo for a year with no reoccurrence. So very cool. Y'all send happy thoughts to all of us here at Medical Coding by Jen. I love you guys, and I will see you on my next live. I hope to see you Saturday for my class, because it is awesome. It really is. That $6 class, if you want to practice questions where you can unmute your mic and literally ask me a question live one-on-one by talking to me, it's a great question. It's a great class. Plus, you're doing real questions without knowing or help from chat, and you're all on your own with your books in your own home, right? It's really cool format. So if you can join Saturday in my little $6 class, it's really cool. You'll get 3 questions sent to you at a time, and then you're alone with your books and have to answer the questions. And then we'll go over the answers, and you'll see the answers and what you did right or wrong or whatever. So it's really cool. Love you guys. I will see you guys soon, irregardless, on a live. I hope this was helpful. Sorry about all the crashing my computer did today. Thank you, Mayfield. Love you guys. I hope this was helpful. Good night, TikTok. Good night, YouTube.